Hey everybody, Stephanie McKay here, and I am just living my best life at Safeguard Insurance. Today, I am going to discuss what the most Googled Medicare questions are, so stay tuned. The first most Googled question about Medicare is, what is Medicare? So Medicare is a federal program available to those who are over the age of 65 years old and who is a United States citizen or has resided in the United States for 5 continuous years. And it's also available to those who are under 65 if they meet specific conditions such as having end-stage renal disease or Lou Gehrig's disease, which is also called ALS, or if they have been deemed disabled for 24 months. So what is Medicare Advantage? Medicare Advantage, or also known as a Medicare Part C, is a private insurance plan that is regulated by subsidies through the federal government. That is part of the way that Medicare Advantage is able to give you low or even no cost premiums associated with their plans. So I like to tell people a Medicare Advantage is more in line with a group plan. It's got co-pays, it's got co-insurance, it's got deductibles associated with it. It does have a max out of pocket, which is a very good thing in comparison to original Medicare having no maximum out of pocket, no stop loss at any point for that program. So that is a good benefit for a Medicare Advantage, and I do try to draw that parallel for people that it does operate closer to a group plan than say a Medicare supplement that's available as well. So Medicare Part D is your prescription drug plan. So you can get a Part D 2 different ways. You can either get it through a Medicare Advantage plan, or you can get a standalone prescription drug plan. So typically what people do is if they get a Medicare Advantage plan, that is all inclusive, it's all wrapped in one. Whereas with a standalone drug plan, most people pair that with a Medicare supplement plan. What the prescription drug plan is designed to do is to help pay part of the out-of-pocket expenses for medications. What is Medicare Part B? So Medicare Part B is your coverage for doctor services and outpatient services. So there is a premium associated with Medicare Part B. The standard premium for 2022 is $170.10. Now, there is what's called an income-related monthly adjustment amount. We call it an IRMA for those who are considered higher income earners. So it is possible if you make above what the government considers standard that you could have to pay additional charges for your Part B. What is Medicare Part A? So Medicare Part A is your hospital coverage when you are inpatient in a hospital. Typically, for those who have worked 40 quarters, which equates to 10 years of working, can get premium-free Part A. If you do not have 40 quarters of working years, you can use an eligible spouse's working years towards yours, or if you do have working history that's just not quite enough quarters, you may have to pay a premium for your Medicare Part A. Let's talk about the difference in Medicare and Medicaid. Medicare is a federal-based plan that is eligible for anybody over the age of 65 or for those that have been deemed disabled for 24 months. We talked about that a little bit earlier in this video. Medicaid is a state and federal-based plan for those people who are lower income individuals. It's usually for those who are right at or below the federal poverty line. Medicaid helps pay for your health care needs. It can help pay for your Part B premiums. It can help pay for your deductibles. It can help pay your premiums, your expenses on your drug plan. All of those things are potentially things that Medicaid can help pay for, but they are two separate programs. Medicare is for anybody who is over 65. Medicaid is only for those people who can qualify based on income and assets. So a Medicare supplement is a plan that is offered by private insurance companies. They're regulated at the state level, and they are designed to fill the holes in Medicare. So a lot of times, like a Plan G, you just go to the doctor, you get your services, you have a lot less kind of red tape to deal with in the aspect of you don't need prior authorizations and some of those things for services. And then on a G, you would pay the Part B deductible, which is $233. As long as the charges are Medicare approved charges, that is all that you would pay. There is no co-pays, there is no co-insurance. Your supplement is handling that as long as Medicare is paying for the 80% that they're supposed to pay for. So it is a plan that differs quite a bit from a Medicare Advantage. And one of the differences is the premiums. Medicare supplements give you more coverage, so they cost more, whereas a Medicare Advantage has very low premiums, but you pay as you use those services. Thank you so much for joining us to learn about Medicare and the different questions that are so very important to your enrollment and success in Medicare. If you feel like you learned anything from this video, please hit the like button so other people can find this video too and can benefit from it. And subscribe to our channel as we're bringing more and more content that can help you through your Medicare transitioning, your retirement transitioning, or any transition you may be going through in your life.